The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod. We're here live. Look who we're here with.
Good morning,
Dr.
everyone.
Doreen Granpeesheh.
We're
Good morning.
both back.
We're both back. I apologize profusely because it was my fault that we weren't able to do a show
No
last
problem.
week. And
I didn't know, and I showed up.
oh no, I texted you. You didn't get it?
No. So the funny thing is, Sarah said that too. She was
Oh.
like, "Didn't you get the text?" And then we looked, and the
Oh.
text has my name, but no number.
Oh, it didn't. So I didn't actually send it to you?
Right.
Oh, but there's like a dozen texts that I've sent to you that you didn't actually get then.
Oh,
That's
maybe.
scary. That's very scary.
Maybe, yeah.
Yes, I wasn't able to.
And
I
then
tried.
2 weeks before that, I was gone. So
Well, but we had Evelyn Collins
right,
sit in
right.
your chair for you, which was a fun thing to have her back. But we always will
Thank
take
you,
you
thank you.
anytime we can have you. It's so thrilling to be back. But I feel
Always
so
so
bad
good.
because I promised everybody you were here last week, and you were. But it was my fault. It was entirely my bad,
no
you guys.
problem.
And we had a topic last week that we were going to do reading comprehension. So we just moved all of that to today. We are live right now. It is Tuesday. It is June 4th. And I know this especially because tomorrow is my kid's 21st birthday. So we
Amazing.
are live right now because I know everybody's like, is it live? Is it Memorex? What is it?
Happy
we're
birthday,
like-
early birthday to him.
Yes, very
amazing.
excited about 21. Can you even believe it? But we're live right now and we're taking your questions. I see that Evelyn has already written in a question. We're going to get to that in a second. Our overriding topic, our starting topic today is reading comprehension, but we will take questions on absolutely anything. Dr. Granpeesheh, as you know, is a true expert in the field of autism. She's been working in this field for more than 40 years, right? The number keeps creeping up. But more years than it looks like she's been on the planet. She's been helping individuals on the spectrum to reach outcomes that are meaningful for them and for their families, helping families to deal with the different stresses, helping us all to deal with the perspective taking, to look at it from all sides, which I always appreciate.
Thank you.
As I move through the world and I hear people saying, it's like, you know how, I don't know, this is a weird analogy, but you know how sometimes you go to a party and it's like a lot of people, it's all very exciting, but at the end you're like, I just want to go home with who I came with.
Yes,
You know
yes.
that? Yeah, and you're who I came with.
I know.
So
I feel the same way.
so I'm always like, okay, this is fun being out in the world. I want to go. I want to go home with Doreen. You make the most sense to me, right? So you're my date forever.
Thank you. That
Autism
sounds
wise,
great.
that's
That sounds good.
But anyway, so I'm always thrilled to
Thank
reconnect
you.
back and have you in the chair because it's like, oh,
I know.
home.
I missed it. I missed
Right.
being with you and seeing you and chatting. We haven't had it.
Yes.
I've been, It's
Yeah.
been a busy month.
it's an extra amount of fun. So we're here, we're live, but Dr. Granpeesheh is going to answer your questions in real time. And I see Brian has written in, and so has Daniel. We're gonna get to these questions as soon as possible. Chris Desmond, who is our fabulous producer, has already started to show you things on the screen of ways that you can interact with us. Please, right now we're live on Facebook, YouTube, and Twitter, and about a dozen other places. Please write in your live questions now. We love those. Don't forget that the show will be available in our archive channels on Ask Dr. Doreen on YouTube and on Autism Live. You can check those out there. But also we'll be podcasting. It's its own podcast now, Ask Dr. Doreen. And you can download that. There's a free download wherever you get your podcasts. This podcast is just tearing it up. You guys, you're just weekly winning all kinds of awards and things and being at the
that's
top
awesome.
of podcasts. It's doing really well. And it's also, we still have some of it on Autism Live. Some of you are watching on Autism Live, but we threaten it on a regular basis that we're going to cut that off. So subscribe on Ask Dr. Doreen because it could happen at any moment now. So, but also want to let you know that if you're listening in podcast, you're getting advertisements, and we hope you're embracing them because that's what makes it a free download for you. However, if you'd like to get it ad-free, you certainly can. You can go to glow.fm/autism-live for just $5 a month. You get everything the Autism Network does ad-free. So that's a wonderful thing, and it will show up in your inbox, and you don't even have to do anything. And then you get in the car and you push the button and you're there.
There you go.
With no ads. So that's a wonderful thing. Okay, I'm going to get started with one question about reading comprehension, and then we'll get into some more questions that you guys are writing online. But the first question, my 8-year-old son can read, but he struggles with gaining the message of what he is reading. I don't know what is missing, so I don't know how to help him. Is this fixable?
Yes, that's a good question. And yes, it is fixable, and it is also pretty common. Just so I don't want you to worry. We do see that a lot with our kids where they are not really comprehending well, we see it at different levels. There are some children who don't really comprehend much of what they're reading at all. And then there are other children who comprehend the basic gist of it, but don't really get the nuances.
Yeah, like an inference.
Exactly. Right? Inferences or, things that are just more subtle and not quite written out completely. So it's all just about, every child is different. And I think what you have to do is go back to the basics and identify, like this is what I would do with your child, with any other child who's having a reading comprehension issue. I would try to find out exactly what the problem is. And it's going to be a little bit different for each child. So you need to go back to the point where he's comprehending everything. And by that, I mean, I'd go to much more simple things. For instance, if right now he is, let's say, you're reading, let's say, a paragraph, well, that's a very big chunk, right? So let's go back and see if you have 2 sentences, how much of that does he comprehend? And also keep in mind the complexity of the sentence. So I would use grade level books because they help you identify, like, this is a story meant for 6-year-olds. This is a story meant for 10-year-olds, whatever. Mm-hmm. So I would keep it at his age level or less, and I would reduce the number of sentences, even the number of words. Like you might have to go all the way back to starting with one simple sentence. That's actually how we teach reading comprehension. We will start with one sentence, maybe even one phrase with 3 words. And then we'll ask questions about it. Yeah. So, Barney went to McDonald's, whatever it is. And then we'll say, where did Barney go? Who went to McDonald's? And sometimes the more complex it gets, the more WH questions we throw in there just to make sure there's comprehension. So you want to start from a baseline where your child is very successful and not having issues, so they're understanding the content. Then you can expand on it, right? Barney went to McDonald's and bought a Big Mac. Now you can ask more questions, like what did he eat there? That sort of thing. And the moment that you reach a point where comprehension drops off, then you have to ask a few different things. 1, was there attention? Was he paying attention, or was the length so long that he dropped off his attention somewhere towards the end, right? And if it's attention, you work on attention. Mm-hmm. Was he attending, but the vocabulary became too complex? Then you have to work on vocabulary. Was he attending, but the sentence now had abstract inferences in it? Like he bought a burger, but does that mean he ate it? So those types of things, you just have to pay attention to what point is he actually starting to lose content? And that topic is then the topic that you strengthen. And it could be lots of different things, right? It could be just adding vocabulary. It could be adding length. It could be adding abstract concepts that he's not familiar with. It depends on what the issue is, and then you expand from there. But absolutely, I haven't had a child who we can't get through that. Now, sometimes if it's a very severe attention issue, like a lot of children who also have ADHD symptoms find it very, very hard to pay attention to all the content when it's a very, very long thing, like a paragraph. And remember, at a certain grade level, we're reading paragraphs and then answering questions about them. So if that's the case, then you might also want to consult with a physician. You might also want to consider ADHD medications. I'm not against any of those types of things because, you know, a lot of research has shown that a combination of behavioral therapy and medication often works for all kids. So depending on your choices, what you prefer for your child, just give them the tools to succeed.
There we go. Amazing. I want to get to a question. They actually wrote this question in yesterday, but they wanted your answer from it. Young girl with autism, I believe she was 15 years old, correct me if I'm wrong, not fully toilet trained. When upset, she chews on her shirt and makes holes in them.
Yeah.
So can you talk
Let's talk about that.
Yeah.
Two separate issues. So we need to, and I wonder why, I don't know if mom is on now. I wonder why you've addressed, like put them both together. Are they somehow related? Does the chewing on the shirt occur only when there's a toilet training issue? Are they related? Or does the chewing on the shirt occur whenever she's upset about anything? So let's talk about the toilet training. Yes, very easy to handle. You just have to go back and go through the procedures. Again, it's just like the reading comprehension we just talked about. Kids get stuck at different phases. Sometimes the process, if you think about it, we never think about this because it becomes an automatic behavior for most of us, but toilet training requires multiple steps. And it's a little bit harder if you're a 15-year-old girl and you're just starting to accumulate this and learn these steps now. I would suggest you just make it easier on her, have a series of maybe instructions. And I don't know if she reads or if you need to put icons or photos or something that helps her understand the next step, right? Because it's like, let me go to the bathroom, lift the lid, take my pants down, for instance, sit down, go there, how to wipe, then putting my clothes back on, washing hands in itself is like turn on the water, get soap. These are all multiple steps. And what a BCBA would do for you is a task analysis where they would write down every single step so that the steps that require assistance are assisted. And usually the way that we do it is that we do as much as the child needs, but no more, right? So that we can fade out and allow the individual to do it by themselves. But toilet training is kind of a touchy thing because a lot of times if someone, especially at 15, if they have an accident, lots of stuff happens, right? It becomes maybe embarrassing for the individual if they're aware of it enough. People around them become very upset. So it can become kind of a traumatic event if there's failure, which is why we try very hard to support as much as possible so that there is success and not failure. But so that's the toilet training part of it. And yes, we've done lots of shows on toilet training. Happy to do another one at some point, but it's a procedure. You go through the procedure and a lot of children do learn.
She wrote in more.
Okay.
She wanted us to know that it's grandmom. She's grandmom.
Okay.
And that the chewing happens whenever she is upset and she is nonverbal.
Okay. So this is really important. Okay. So the chewing happens whenever she's upset, and you're kind of you're in that sentence, you're telling me exactly what's going on, which is she's, think of other children, typically developing children who also will, or adults actually for that matter, who are, let's say they get upset and they will bite their nails, or they'll get upset and they'll pick at their skin, right? This is exactly that. So it's a sign of, I saw later further down that someone was referring to it as a stim. I don't really like to call these behaviors stims because I feel like even self-stimulatory behaviors have something that's causing them, right? And it's important to address that. I see it as a sign of kind of anxiety and frustration And a lot of times when we are frustrated about something, we behave in a certain way when others are around because we feel like a failure, like we failed. So now I don't want to fail again. I don't want to, it's anxiety.
Yeah.
And so I think what you have to do in that case is you have to give her two things, actually. One is you have to sort of, the anxiety's there. Let's face it. That feeling of kind of panic or dread is there. So we're starting from a place where that anxiety is there. So during that time, what can she do that is not self-harming in any way? Like what can she do other than chewing her shirt at this point? Okay. Is there something else? Well, yeah, there's lots of things. You could give her one of those squoosh balls, for instance. You could just hold her hands and massage her hands for her and tell her it's okay. You can give her other things to occupy herself with. But the bottom line is we need to reduce the anxiety. Right. We need to let her know it's not the end of the world. Yeah. So when she is frustrated, she will need to, or upset by whatever reason, she'll need to have some way of taking a break and communicating that she's upset. So I want to go back and say something that I often say, which is challenging behaviors of all types are, especially for nonverbal kids, are a form of communication. If they could talk, what would they say? They would be saying something instead of chewing their shirt. I've seen that over and over. When the child learns a different way of expressing themselves, these challenging behaviors tend to decrease and even extinguish completely. So the question is, when she is upset, what would be an appropriate thing for her to say? Would it be, and children are different, would it be, I need a break?
Yeah.
If she needs a break, you need to teach her, and she's nonverbal, you need to teach her either on an OG device or on an icon, just a card that she can give you that says break. Leave me alone for 5 minutes, right? That's all I really need. If she needs a calming place, she needs to learn, you need to teach her to get up and go to her calm place. We often, for our kids who get upset, frustrated, and start to do things that are not productive, we'll set up an area for them that is their calming place. Because remember, our kids have to learn how to self-regulate, how to calm down. When you're upset and it takes you a few minutes, you'll say, I need a minute, right?
Yeah.
And that minute is usually 15, 20 minutes where you're trying to calm yourself down. Our kids need that too. And you can arrange that for your child where you have an area where the child learns, when I go here, I get to sit on my comfortable beanbag, put on my Bose headphones that are sound dulling, and listen to something or watch something or soothe myself, right? And that is what if I do that whenever I'm upset, I'm not going to be frustrated, because frustration is kind of like a buildup of not being able to communicate. So right now, chewing on the shirt is not the worst thing. I mean, there could be a lot of other things that she would do, but in the long run, honestly, it can become problematic. Like I have a lot of children who chew on their shirt, and it gets pretty wet and it starts to actually have bacteria, and it becomes a very difficult thing. They get ill more, they get sore throats, all kinds of stuff, or sores in their mouth, or problems with rashes on their chest. You just don't want to allow that to continue. This is getting to the point, and especially if she's 15, I really do recommend that you consult with a behavior analyst, because what they'll do is they'll take every situation that she gets upset and they'll ask a lot of questions and they'll observe and they'll do what's called a functional assessment. And that helps them figure out in each scenario, what is the cause? What's the reason for her being upset? How can we give her communication, or how can we give her an out, some other thing she can do in order to not get upset, in order to communicate what she wants. And that's kind of a little bit complicated for a parent or a grandparent to do. So if it's possible at all for you, I would really recommend that you talk to a behavior analyst and try to get guidance on that. Something I always wonder about, Shannon, it's like, as an owner of a clinic where we provide ABA services, I wonder how many parents would just like to have access to not the actual therapists who are doing the work, but just a behavior analyst who could answer their questions on the phone, as a service. I always wonder about that.
Yeah, and I think people would like that.
They would, huh?
I do.
Yeah,
I do.
yeah.
I definitely do. But you guys write and tell us if you agree. So many people writing in. We're going to get to as many of these questions as possible, but saying hello to Joannie, Autism Journey with Elijah, Munia, we're so thrilled that you're here. Icy, we're thrilled. And Amanda and Lucy as well. Autism Journey with Elijah has already said, I would love that. Okay. I also want to say, Amanda, can you be more specific? Because I'm not sure I understand the question. Who advocating where to who? Can you be as specific as for me as possible? I want to get to Brian's comment next. And Brian, I sent you an email this week. I don't know if you got it. So check your email. I did send you an email. Brian says, good morning, Shannon and Dr. Doreen, coming to you live from Long Beach today and giving our 2E 7-year-old son new experiences like an aquarium here.
Great.
I imagine you say, use the summer to open his mind with positive life growth events, and I hope that all parents try to do this. Can you recommend great ways to use the summer wisely for ASD moderate to high function kids?
So I wish I could give you just a list of activities, Brian, but it is going to be different for every child. So, yes, thank you for telling me kind of moderate to high. But even within moderate to high, you're going to have a lot of different types of children. So, and each child is going to have an area where they would need practice. I just see the summer as an opportunity to not worry about academics and use it to catch up with whatever else we need to catch up with. I'll give you an example. If it's, let's say, a 7 or 8-year-old child who's moderate to high, maybe I want to work on riding a bike, because riding a bike is going to allow that child then to hang out with neighborhood kids. That's just one example. Maybe I want to work on softball, because if I do that, when the child goes back to school, it's going to allow them to hang out with them. Maybe I want to work on selecting books from a public library, because this child is a reader. Maybe, so it really has to do with what are my plans for the child for next year, and how can I use the summer to kind of strengthen the foundation of those plans. Sometimes it's just about getting more hours of individualized ABA to get the child ready for even their next academic year, or for activities that they might have fallen behind on, swimming. I don't know. There's so many things, things that we don't have a chance to teach during the school year, because a lot of times, obviously, kids are in school until 2:30, 3. They get to the ABA clinic by 3:30. We have a couple of hours with them. We're working on kind of language and social skills and things that are very important. But then we never get to do things like, dressing and chores at home, and how to make a sandwich for themselves, or, how do I interact with a group of other children, or whatever, appropriate behavior at the mall. I mean, there's a million different things that I could think of, and it really is pretty child specific. I do love, obviously, the idea of being able to go to interesting places like the aquarium with a parent. That's just like the most fun thing ever. If it's possible to grab a couple of friends and take them with you, that's even better. But yeah, I mean, depending on each parent's circumstance and each child's level of skills, that's going to be a different thing.
Yeah, I think I've shared before that there was one summer, and I don't remember whether it was 6 to 7 or 7 to 8, that I just went through and looked at all the museums and things in Los Angeles that had a free day and what day it was.
Gosh.
And it was a lot of Thursdays. I don't necessarily recommend the free day, because I found out it's the busiest day.
Yeah.
But it made it free. and that was important. But I made, before the end of the school year, I made a list and said, on this day we will be at this beach, and at this day we'll be at this museum, and on this day, and it was Thursdays. We called it Thursdays with Gem, and I handed it out to the whole class. And I didn't ask for anybody to RSVP. I just said, we'll be there at noon at that time. And I was terrified of how it was going to work out.
Yeah.
Do you know? Because like, what if the whole class showed up one place and I got yelled at?
Yeah.
And what if nobody shows up? And you know what? It worked out brilliantly that we would go and there'd be 1 or 2 kids. It would be a surprise. Oh, you're here.
Oh, how nice.
And we would do whatever, but we did a lot of museums and things like whatever we tried to do in the summers. Then we tried to make it experiential.
Yeah.
Even if we went to the mall.
Totally.
Like there's something at the mall that you can do it could be just trying on shoes.
Yeah.
Like learning how do you try on shoes and how do you put them back and, do all those things. But I remember going to a mall. It was really what started the whole virtual reality stuff. They had a demo set up in the mall. And so that was the thing that we decided to do. And he did it. And then he had me do it and help me out doing it. And that's what fired all of that. So then he worked for getting a VR thing. And the first thing he wanted to do when he got it was to show it to Dr. Granpeesheh.
Oh my God, it was so fun when he
amazing.
I was like, I couldn't believe it.
I mean,
not only me, but everyone in that office signed up for half-hour segments or something,
but
so
it was
he could
you
show
that
us.
He was like, I want to show this to her.
Oh, it was amazing.
Because he knew you would get it.
Oh, I was like blown away.
Yeah.
It was my first introduction to VR was
But all the fun things that you can do in the summer, but it literally, I think we all think it requires, like that one summer, it was a lot of planning.
Yeah.
But it took a day to like plan the whole thing out. And then I just sort of, did it the rest of the summer, one day. But you could do anything.
Yeah.
You go to Walmart and you decide, okay, today is the day when we're going to talk about how we pick out fruit.
Absolutely.
Like what's a ripe watermelon? What's those just all the life things that you can't cram in on other days.
Absolutely.
Good. But I love that you're at the aquarium. And I'll tell you the other thing, when you do stuff like that, first of all, the world is getting used to your child's getting used to the world, and you're finding out what they like.
Oh yeah, that's a good point too.
And then once you find that thing, then you double down on it, right?
Yeah. And I do want to also just say that, for some parents, it's hard to take their child into the community because their child's not quite there yet.
Yeah.
But even for those parents, I think it's an opportunity to do things at home.
Yes.
Like I remember when I had 3 children who were about 2.5, 3 years apart, right? So when I took my children to Germany, and a lot of times I didn't have a car, we were staying at a friend's house and they were all at work and I had the kids, I would take with me a bunch of crafts from Michael's or from 99-cent store, honestly. And it was just a great opportunity to do things like teaching the child how to set a table, teaching the child how to do laundry, stuff in the house, but also then like having breaks and doing gardening, doing crafts. Like there's so much stuff that you can do in the summer. I love it.
We made a big long list during COVID. It started out being 101 things you can do with your kiddo at home.
Oh yeah.
And then we just kept adding and adding and adding to it. If you Google it, it will come up on one of our blogs. It's also, I included it in the back of my book. But it's things like, play beauty parlor.
Yeah.
Absolutely. And you make them the entrepreneur. They're running the shop and they're going to do your hair. I mean, there are all these old school things that we used to do before the internet, you guys, that you can do with your kids that are really good teaching things and fun. Okay, so Joannie wrote in a question about reading comprehension. Reading comprehension is a big problem for my 11-year-old son with ASD. We discovered he was hyperlexic when he regained speech. He regressed into autism and picked up a book I was going to read to him. He also made long words with magnetic letters like pumpkin. School tested him and he could read at an 11th grade level, but struggling with comprehension since 3rd grade. We were told he has a problem with working memory, short-term memory, and processing. Who do we see for this? How do we work on these? How do we work on it at home? He is minorly affected by autism, is finishing up 5th grade, is mainstream 90% of the day with a one-on-one aide, because you're so amazing, has had ABA, speech, and OT until 8 years old, only 15 hours of ABA. I couldn't get more, and boy, did I try. I just love you so much. I don't get an opportunity. So many of these people I now follow on Facebook. Like it's odd that I don't mean to stalk any of you. But this is a wonderful, wonderful mom, does amazing things. Your family is so beautiful. And of course, if I thought for a minute my son was going to school in Philadelphia, and so you were going to be my realtor. I just want you to know that was happening, but that didn't happen. Okay.
So, Jenny, I'm always so happy when we've produced something in the past that can be helpful to one of our viewers. And so there's a whole section on skills. If you get into skills, our online curriculum, if you go in there, there's an entire section on memory. And it's in the executive functions, I think. It's either in the domain called executive functions or in the domain called cognition. It's in one of those two domains, but there's lessons, activities that you can do that are not necessarily focused on, reading comprehension. There is actually another whole section on reading comprehension as well, by the way, but just on memory. There's lots of memory tasks that we have taken from IQ tests and that we've put into activity format for our parents to practice. And we actually have separate sections, I think, for short-term memory, for working memory, for processing speed. And they're similar to, if you know that he's struggling with those areas, then someone has done either an IQ test for him or a neuropsych test like the NEPSI. And either one of those would have told you that there's delays in those three areas. Fortunately, those are things that you can improve with exercise. Just like, as we get older, they tell you to keep doing memory games and brain activities to keep your brain active. Same thing when you're young, you can actually do a lot of types of different activities that will enhance memory. For instance, you'll read a series of words and then do another activity and come back and ask the child what those words were. That's one activity. There's lots of different things for memory. So just go in skills, see if that helps you. If not, write to Shannon and we'll try to find a kind of separate list of those lessons and send them to you.
Okay, let's be in cahoots on that. Monia has a burning question for us. My son had so many behavioral issues with his therapist during his recent session, exceptionally bad with her. She believes that all of this is coming from his need to control everything. The issue is that if she asks him to do something and he refuses, she will just continue to repeat the same request over and over and over again, and it will continue to escalate. It's awful. If her analysis is correct, and it might be, to be honest, I'm not sure that this is the right way to proceed. Can you please tell me how can we work around his need to control everything? How can I help him? Thank you very much for everything you do for us. I love you both. We love you back.
Hi, Munia. Okay,
Yeah.
So she could be right that he's trying to control things. She could even possibly be doing the right thing, but I'm not sure. And I don't want to, I would never tell you to just let it be and see what happens, because I think you've watched enough of it where it's a little disturbing. Yeah. So you refer to her as a therapist. So I assume that you also have a supervisor. Let us know if you do, because this is where you need someone else to observe what's going on. And, when a child has issues, whatever the issues might be, let's say it's an issue with wanting to control the situation, I will figure out other ways to give the child a little bit more control. So, for example, I will give the child the ability to select the next activity for the whole day. And that allows the child to feel like, oh, they're in charge of what we're working on today. I never want to get to a point where it's like a battle, because you kind of want to, there's no point. You're not trying to tame the child. You know what I mean? You're trying to teach the child. So if it becomes like a battle, you need the therapist, and the BCBA would possibly tell them this, needs to back off, make it simpler, make it shorter so that the child is successful, reward more. Whenever a child becomes really like stubborn, obstinate about something, they're clearly getting more attention from being stubborn than the reward of doing the right thing. And you always want to make sure that your child is motivated only by the reward of doing the right thing, as opposed to pissing you off, right? And that's what it sounds like. So what the therapist should be doing is revamping the whole thing so that it's a new structure. It allows your child to have more control over the choices. It is shorter, gives him more rewards, and then gradually starts to increase it. The other thing I wanted to say is whenever a child gets upset with repetition, he could be bored.
Yeah.
Like that's a big issue. So please pay attention to that as well. Sometimes people don't realize how it's easy to miss how intelligent our kids are because they don't overtly show it. They don't overtly communicate about the things that are going on in their head. And he might just be bored because the repetition is too much. With children like that, we have taken like we have like this thing where we say someone has mastered something if it's 80 to 90% correct over X number of trials. Like that's how we establish that it's mastered. We might move the needle on that, and we might say, you know what, this child gets bored. I'm going to assume it's mastered at 70%, and I will check on it later on because I don't want the child to get frustrated because he's repeating something. So those are other things to check out. And I don't know if you have the ability, but just like we were just talking to Johanny, it's very helpful to have some sort of IQ or neuropsych test because it really tells you how a child is learning and what are their strengths and weaknesses. And that'll tell you if it's a control issue, if they're bored, if they are in need of more assistance around whatever this particular subject is. So it could be any of those things.
I always get concerned because if the person is saying, well, your child wants to be in control, and my answer to it as a trained behaviorist is that I'm going to force the issue, to me, something's not quite right.
Right.
It sounds more like the therapist is the person who needs to be in control.
Yeah.
And that's not always the right way to be looking at things from what I have seen. I was at a center not that long ago, a couple of months ago, and I heard an interaction between a BT and a kid, and it just struck a chord with me because I can remember a day and a time when they were doing the same thing with Jem, where they said to the child, okay, we've got 2 minutes and then we need to pack up this toy that clearly they were loving playing.
Oh,
right?
Yeah.
And they said, okay, so, and the child was like, no, I don't want to do that. And the therapist, didn't give a big reaction to that. At all, didn't say, I know you're upset, just allowed the child to have whatever feelings. And then a minute later said, okay, we've got 1 minute before we're going to pack the toy. I don't want to do it. The child was voicing on, and the therapist didn't feed that, just continued on with whatever and said, okay, now it's time to pack. I don't want to. And they said, so we can go to this or we can go to that. Yeah. And they stayed very calm, and the child, but I don't want to do that. I don't want to do any of those things. And they stayed calm, and they were like, so would you like to do this or would you like to do that? Mm-hmm. And they just kept giving them choice,
right? But
not getting embroiled in the emotion that the child was having, nor telling the child stop overreacting,
right?
Or telling the child, bargaining, saying you can have it later,
right?
Whatever. And the child had all the emotion, voiced all the emotion of, I really don't want to do that. But they continued to give choices.
I love that. Yeah.
And I afterwards went and found that BT and said, I want you to know I heard you doing that and I love you.
Yeah.
Right? Because the child worked their way through it and then went happily and skipped off to do the one of the two that they were given the choice of.
That's right.
It doesn't have to be
aggressive
that hard,
or sort of,
but we also can allow them to, and people sometimes go, well, that's really cold. The child's freaking out and you're not saying anything. You were letting them have their emotion about it.
Right, right. And you're not supposed to say anything, because the minute that you engage, you are actually teaching the child that their escalated reaction will draw attention.
Right.
And sometimes that attention from you is enough to keep that going, their objection. And when you ignore it, the child realizes, okay, my reaction is not going to alter the circumstances.
Right.
We're just going to have to move on.
And he realized he did get his choice in the end, because choice, when you need to be in control, choice is everything. Even if it's two things you don't really want to choose, it's better than not having a choice at all, because that's control.
Exactly.
So that's what worries me about this scenario, is that if what he wants is choice, then why is she not giving him a choice? Even if there are things that, well, you can do this, or this.
Yeah.
Like, that would be the way I would want this
Absolutely.
PT to do
Or
it.
even a choice of the reinforcers, any kind of choice. But also, I want to be cautious around this, because we don't know this child. Yeah. We don't know the child's challenging behaviors. We don't know what exactly is going on. And Shannon gave a great example. I love that example, because in that example, if you were to back off at all, then the child would learn that their objections worked.
Yeah.
So it really, behavior analysis has to be carefully designed and planned so that you're not rewarding the wrong behaviors. And I that's why I recommend that you get the supervisor involved.
Yes.
To observe, that's what the supervisor is supposed to do, and to identify exactly what's going on. But certainly, you should not be in the middle of an ongoing battle forever.
Yeah.
That shouldn't be happening.
Yeah, no. Okay, I asked Amanda for more clarification. She's wanting tips for advocating community goals and independent living skill goals within an ABA company. And I asked for clarification because she's having some difficulty with the ABA company putting those on as goals. Mm-hmm. Now, I don't know how much of that is insurance, because ABA can work on those things, correct?
Yeah, absolutely. No. Yeah. So independent living, 100%. Yeah. So things that are covered by insurance have to do with reducing the symptoms of autism. Just look at it that way. So, anyone can pull up online on Google the diagnostic symptoms of autism, and you'll see things like, is not able to communicate or interact socially with others. Okay, so if that's a symptom that your child has, or is delayed in their social interaction with others, then certainly you can teach them things like, interacting with people in social environments. If, for instance, one of them needs assistance with daily living skills, then independent living skills will definitely be something that your insurance should cover. It doesn't matter the age of the child. It just matters that it is medically necessary. And the definition of medically necessary is that it is associated with a symptom of autism. And if it was reduced or improved, then that individual would have a better life.
But a lot of people are getting pushback from their ABA providers about certain skills. I know, because I'm always big about saying, ask to do stuff in the community. Mm-hmm. Your program has to have legs. Ask to do stuff in the community. Mm-hmm. I know I'm butting up against that. There are some insurance companies that unbelievably don't want to do anything, pay for anything outside the center.
I don't know that that's true. I think that you can appeal and fight that, and if it comes up, because doing stuff in the community is the last part of any ABA teaching, right? Because if I teach someone in a setting, like in a classroom, like let's say I teach them how to interact with me, right? But I've never taught them how to interact with their parents or with strangers or something like that. Right. It's a pretty useless skill.
Right.
Because I'm not going to be in their life forever.
Right. Exactly.
It's about being able to do those skills in their environment and community. Even in school, like the one setting that payers, insurance companies often fight about is services in school. Because insurance companies are trying to say, that's not my responsibility, the school should be paying for that or doing it, right? But if you make a case that it's not an academic issue, it's a behavioral issue, it's an issue having to do with the symptoms of autism, the child, I'll give a great example. I had a child who would have a terrifying reaction every time the school bell went off in between classes, right? It would throw him into complete disarray. And so because of that, we were able to get funding to have an aide with him for years, because it was about getting him to transition from class to class, even though the school wouldn't do anything about the bell. You know what I mean? And so if it's an issue that he or she requires support due to their autism, it doesn't matter where it is.
There we go. But in terms of if you have a reticent BCBA who is concerned about that how do you advocate for that with a reticent BCBA?
Change the BCBA. Honestly, I've had so many circumstances where it just takes so much effort to try to get BCBAs to argue and defend and support their child's needs against, I guess, some management or, doctrines that are given to them from their management, who is afraid of losing a contract with a payer.
Okay.
That kind of stuff is real, right? Payers will come back and always will force us into situations where one year we lost our contract with a major payer because I wouldn't back off with kids. And we ended up having to, in order to get our contract, it affected something like, I want to say 150 kids, and they still didn't care. Yeah. And so we ended up having to meet with their person once a week and review every single case and all of our recommendations for over 100 kids in order to get our funding back. And you know what? We didn't even have to change a lot of our recommendations. They were just being stubborn. Yeah.
Craziness, absolute craziness. Going back to when we were talking about the chewing and the picking the skin and that kind of stuff, Lucy wants to know, can redirecting with a sensory toy or fidget toy help with kids who chew on their shirts or pick their skin or pull their hair?
Yeah, absolutely, Lucy. It depends on, what you want to give the child. Definitely. I mentioned those squoosh balls, but certainly fidget toys or other types of things that can keep their hands occupied and are less disruptive, I guess, are good replacements.
Daniel had written, when you were talking about doing an assessment for the anxiety, Daniel says, what if the assessment triggers her more? Nonverbal doesn't mean she's not aware. If she feels more like a set of data points or statistics, it could exacerbate her frustration with the core issue. And I love that question, Daniel, because I think it gets right to the heart of what some of the miscommunication is with ABA, because I'm 100% sure that there's some person that is doing an assessment in a way that makes somebody feel like a data point. And I'd like to find them. If you know their address, I'd like to find them and kick them with a pointed shoe. But I can tell you, my immediate thought when I thought of this was thinking about CJ. We have this amazing person who works at the Center for Autism and Related Disorders, CJ. And I remember him doing an assessment with Jem to sort of, see. An assessment sounds like it's this really dry, like a
series of activities usually,
right? Yeah. But he was on the floor playing with him. He's like, hey, can you do this? And trying all this stuff. And it was hilarious. They were on the floor laughing hysterically. You would have had to have been a trained professional to have known what CJ was assessing. Yeah. And my son would never have known. And if I hadn't known who CJ was and what he was doing, I wouldn't have known. Yeah. So I appreciate your concern. It's so misplaced if it's somebody doing it well.
Definitely if it's somebody doing it well. And I will say, CJ is a genius in so many different ways. Yes. And I do want to say, Shannon, that you're right. Most tests are just a set of activities. They're not, there's no way that anyone would know what you're testing. When I'm doing a speech test, or if I'm doing an IQ test or a neuropsych test, you can't tell which one I'm doing. Right. There are a series of activities. So can you put the blocks on top of each other? Can you put the animal inside the farm? That kind of stuff. But that said, if you're not familiar with autism, if you are just someone who's a psychometrician or someone who's trained to do testing, it may cause your child some anxiety because they might be dry and they may only give, by rule, by the way, you're only allowed to give instructions a certain number of times. Like we as people who are familiar with autism know that it's important to get the child's attention, to be rewarding, to be animated. A psychiatrist or psychologist doing these tests is not necessarily going to do all that. And they may put objects in front of your child and then give them one chance, and if they don't get it, withdraw the objects. Absolutely. So let me ask you a question, Daniel. When you go to see your physician for a regular checkup, do you have a little bit of anxiety? We all do, right? Yeah. Everybody does. We're going to be blood draw. They're going to be looking in your eyes, ears, who knows what kind of things, who knows what kind of painful type of thing, like a blood draw maybe, or I don't know if I recently did, Shannon, this lung test where you have to blow for a while. And it's like, you feel like, oh my God, I'm going to pass out if I do. Yeah. So there's anxiety associated with it. But why do you do it? You do it because the outcome is more important. And that's really important. Yes, no one said our children don't experience anxiety. When they go to their pediatrician, they might also experience anxiety. But it is important to know the results, because the results help us not just protect our kids when it's a physical thing, but learn how to teach our kids, learn how to communicate with our kids. If I didn't do an assessment with certain children, I would never know that they don't hear instructions that are verbal. They see instructions, so they're fully visual kids. When I learned that, I'm like, oh, wow, I have to do all of my instructions in a visual way. There are some children who, if you give them a stimulus too close, they won't be able to see it. If you put it out here, they're fantastic at it. Imagine the frustration of the child that you're avoiding just by doing that test of binocularity to figure out that the child's visual field is about 6 feet out, right? So the results of these assessments can be important. You don't need a score. You don't need to walk away and say, oh, my child's IQ was this or my language was that. That's not the point. It's the detail of the assessment that helps us learn how the child is receiving the world. That's valuable.
Yes, amen to that. Autism Journey with Elijah. I have a question. Can a child's hearing with ASD play a part with diagnosis? My son has been yelling when he talks. When we respond, he covers his ears. This just started 2 months ago. He was just referred out to an audiologist.
Yes, it can definitely be a factor. So sensitivities like this is kind of one of the things that I enjoyed about the latest diagnostic manual, was that it does take into consideration sensory dysregulation, sensory irregularities. It never did before. But there's no question that some children, I remember, God, years and years ago, before, I don't know, we must have been on 2 diagnostic manuals ago, or even, DSM 2 or 3, long time ago. I remember being in the house of a child with him, and I noticed, I was working with him directly myself, and this is when I had it was like early 1990s, right? And I remember he would completely stop doing whatever we were doing and just look out the window, and I'd be wondering, like, nobody called his name. Like, what happened? Right. And literally, like, within 15 seconds later, I would either hear an airplane going by or a truck or something that 15 seconds earlier than me, he heard. Yeah. So there's no question. And I remember thinking, oh my God, and his parents would come in, and I'd be like, have you guys noticed that he here? And they're like, oh yeah, he's like very sensitive to sound. And so there's no question that our kids are hearing things that we don't hear, some kids, and not hearing things that we do hear. So I'm glad that you're seeing an audiologist. Obviously, please also make sure that the hardware is okay. So no ear infections, or sometimes our kids have like water or even wax or something like that. So make sure that's all good too.
Oh gosh, I had that thing the other day where all of a sudden my one ear was clogged right before I had to do a 2-hour talk where I could hear myself echoing the whole time. I was like, oh, somebody put me to sleep.
I know, it's so hard.
It is hard. And then it cleared. So I have to get to this question because I promised Marina I would. We have a 4-year-old son with a 2-year-old diagnosis of autism level 3. He's nonverbal and seems to have little receptive language. He's
Can you start again? The age was
4-year-old son diagnosed 2 years ago.
okay. So he was
Level 3.
diagnosed at 2, and he's
With a
level
level
3. I assume 3. Okay.
Nonverbal.
Okay.
Seems to have little receptive language.
Okay.
He's been getting about 10 to 15 hours a week of home-based ABA. My question is related to breastfeeding. He's still breastfeeding and sleeping with me, mom, and I'm not sure how to wean him without making him feel rejected. He's very food selective and doesn't communicate hunger cues or bathroom cues, so I'm constantly asking and offering him food. He prefers to nurse. I'm at a loss on how to increase his appetite so as to decrease and ultimately stop the breastfeeding. Thank you for any help.
Yes, that's very hard. I'm sorry that you're going through this. Okay, so yes, you need to wean him off. Very important. You can, my recommendation would be just to wean him off. So that means you're going to gradually, initially I was going to say you can certainly find like some sort of replacement that it has a similar texture or, and I don't think you need to do that. He's 4 years old. We need to get him in school. We need to get him out of breastfeeding. So the hardest part is going to be actually for you living through him being upset about it. Please don't feel that just don't think that he's feeling rejected. There's lots of other ways that you can make him not feel rejected. Lots of ways that you can give him love and make sure he feels comfortable that are more age appropriate ways. Okay. So if I were you, I would begin with making sure that he doesn't have access. He will, a child of 4 is going to try to take your clothes off to get to you at this point. And I would actually do what they do in the hospital when you want to end production of milk, which is they wrap you. And I'm sure you can do that actually with just regular
ace
bandages. Get a really thick ace bandage, or you could even get a body thing that you wear, and so that he doesn't have access. He cannot easily reach in.
Yeah.
And then I think what you do is you can certainly reduce it to maybe if it's, did she say how many times a day or anything like that? I mean, you can certainly start with, you can either just go cold turkey, or you can do, it's like 3 times a day right now, and I'm going to reduce it to 2, and then I'm going to reduce it to 1, and then I'm just going to cut it out. You can certainly do that, but please give yourself a deadline. Don't let him establish the timing. You establish the timing. Give yourself a date by which this will be finished. Because, and the reason I'm telling you that, and get support. The reason I'm telling you this is that it's a he, right?
Yes.
Yeah. He will object. He will object. That is totally fine. Find another food type item that he enjoys. Either a food or a drink that he enjoys. I'm not a big supporter of milk in general. I would suggest that if you are considering milk, you might want to consider something like almond milk or oat milk or some other type of plant-based milk. Dairy these days is not very good and has its own issues. And then you can also sweeten it. You can also put a little bit of cinnamon in there or vanilla or honey and make it taste better. But replace it. I would not go to a bottle at this point. He's 4 years old. He doesn't need a bottle. You can use a sippy cup if he's not used to drinking from a regular cup. You can give him a straw, teach him how to use a straw, which is often very good also for language development. But that's his replacement. Now let's just talk about this. When you say no, you need to walk away, do your thing. He will have a big tantrum. Expect that. He will be upset. He will try to get to you. That is okay. Don't engage. This is when what's called an extinction burst. That means in the past, he was used to getting what he wanted, and now you're not giving him what he wants, because let's face it, we can't always give our kids what they want, because it's not environmentally appropriate, right? So that's okay. You're going to give him something very nice instead. And the sooner he learns that there are things in society that we have to do a certain way, the better it is for him. Because remember, he's going to have to go to school. He's going to have to interact with other kids. He's going to have lunch with other kids. So you're beginning to teach him adaptive skills. Think of it that way. But it doesn't matter if his tantrum goes on for a while. Please do not give in. If he initiates a tantrum because you've said no and you give in, then what you're teaching him is a longer tantrum. So the next time around, it'll be harder. This is what's called an extinction burst. If you're having a really hard time, and you have to just let it right out. You just have to let it right out, at the end of which, when he takes a breath and is starting to calm down, you offer him the other thing, okay? There's a whole procedure for doing this, and I worry about you as a parent doing this on your own. My recommendation is, if there's any way at all that you can get an expert to help you, someone who's gone through teaching children to alter their choices, it would be very, very good for you. It would either a behavior analyst or an experienced behavior technician. They can really help you. Honestly, it's not as hard on him as it is on you. Yeah. I often say, like, the hardest part is parents. It's hard for parents.
It is hard.
I know I'm going over. But I'm so concerned for this parent.
I know, but they do get 10 to 15 hours of ABA in their home, which means they are working with someone. But can I also just say before we part that 10 to 15 hours for a child who is 4 and a level 3, that is not what would be scientifically recommended. You need more intensity, more help, more support, and your insurance should fund it in this window of time.
Yes. So
I would push back on that and get more of that. Yes. I personally would love to see you having 40 hours. I know that, but you always talk about every waking hour.
I would too. At 4 years, you have the opportunity to teach him actually a lot.
Yep, but it's now. So please ask for more of that and lean into those folks. I'm sorry we didn't get to absolutely everything. Amanda, I want to make sure that you will email me. And Daniel, I want to say that I'm sorry that someone did that with your son. I started out by saying, if you know who that is, you should, let me know. But you can also write to them now and let the school know that was not acceptable. So anyway, we're out of time. Tomorrow, we have a very special episode because I'm not going to be here because it's my son's 21st birthday, as I mentioned, but we pre-recorded yesterday. I go through all the autism diets and talk about what for what and what it's like. Amazing. And, so that's tomorrow.
That's awesome.
Then on Thursday, we are doing our best of. So we're replaying an episode from 2 weeks ago with Evelyn Kong on motor skills. That was super fun. And then on Friday, we're replaying Best of Ask Dr. Doreen, the part 1 of diagnosis and misdiagnosis of autism. I'm sure you guys are going to want to tune into that. And then we'll have more exciting shows next week. And I will have a 21-year-old. So
that's amazing.
All right, you guys. We'll see you next week. Thank you so much, Dr. Granpeesheh.
Always a pleasure.
Give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.